You're welcome to my channel. Today I'll be talking about conversion disorder. When you go through the literature, you might find this under different names. Might be conversion disorder, that is CD, or FND meaning functional neurological disorder, or FMD meaning functional movement disorder. Conversion disorder, affected people are not faking it. Please know that. When it comes to conversion disorder, anyone that is truly diagnosed with this has not faked the symptoms. No. There will be sudden blindness, paralysis, or seizures, and so on. We will go into full clinical features later on. It is always secondary to emotional, physical, or psychological trauma. There is an entity known as labelli indifference. Labelli indifference is found in conversion disorder when the affected person is not showing a level of concern that is commensurate with the conversion disorder symptoms or the hysteria. Some experts are now working against that nomenclature. They are trying to tell us to abandon the use of labelli indifference. The argument is that the nomenclature is not backed by the evidence to separate conversion disorder from other related organic diseases. The experts don't want us to define conversion disorder using the term labelli indifference. You might discuss this further with your professor. Now, what are the clinical features? First symptom in conversion disorder is during adolescence or adulthood. 14 times increase in chances of having conversion disorder is possible if there is first degree relative with the same diagnosis. Still on clinical features, the affected lady might complain that I can't see, blindness, or paralysis, or loss of voice. They may have gait anomaly, and they may not be able to smell and nose me. Still on clinical features, they may lose sense of touch. They may complain that they have tingling, and some will actually have seizures, or they will present with hallucinations. What are the possible risk factors here? An individual with personality disorders will likely come down with conversion disorder. Anyone with dissociative disorders, and of course it's common in women and in low socioeconomic status, also amongst military personnel. Causes. While in medicine, when we can't find the cause, we have somewhere to hide. We call it idiopathy, unknown cause. But mostly due to physical stressors, psychological trauma or psychological stressors like infidelity in the spouse. If there's decreased blood supply to certain parts of the brain caused by the stress, then the lady could be down with symptoms of conversion disorder. How can we make a proper diagnosis of conversion disorder? History. Just go through the history being presented right here. I mean, the clinical features, go through all of them. Then physical examination, because you are concerned, could this be secondary to any organic condition or any disease here, any physical illness? So go over the entire full neuro examination. Depending on the level of suspicion of what you think might be responsible, you can have complete blood countdown. You may screen for medications, street drug as you may suspect. So you can have toxicological screening done. And you may rule out the low level of some electrolytes or excess of any of them. So you can have electrolytes acid. And still on diagnosis, rule out all possible neurological conditions that could present with that. Okay? And rule out other psychiatric conditions, personality disorders and dissociative disorders. Get to know of any psychosocial stressors like infidelity in the spouse. And then go to the laboratory, have urinalysis fully done. Asking for the level of vitamin B12 or methylmalonic acid. Get to know the value of the glucose and the lipid. You might have the CT of the head done and electroencephalogram, EEG. Still on diagnosis, conversion disorder will be finally diagnosed with the following. Number one, no physical illness is diagnosed. You've run all the probable tests that you could, you've taken your history and everything, there's no physical illness diagnosed. Then that's a pointer, it is conversion disorder. No other diseases can help to explain the presenting symptoms. You can see the symptoms, but you can't, you've done everything, you can't come down on anything that is actually causing that. The neurological symptoms is or are real. Like I told you earlier, they are not faking this, but there is no physical illness leading to this. The life is being affected to the point of needing medical attention. For example, this woman is no longer going to work. She's not capable of looking after a newborn baby. You could see this has affected her. Now, how do we treat? Accurate diagnosis is the key here, because without accurate diagnosis, we will not have appropriate treatment. Once we've made appropriate diagnosis, then appropriate treatment may follow, starting with psychotherapy. Counseling with or without the spouse, but I would suggest with the spouse. Or if the acrimony is so intense and you can't put the two of them together in one room, maybe you do it separately. Occupational therapy, because now she's having trouble walking. Imagine a nurse or a physician, female, having this. Medical error could be very costly. Physical therapy, if the lady is truly having seizures, at the time of presentation, please abort that seizures, with lorazepam, depending on what you use in your jurisdiction. Let ophthalmologist review, please, because if she tells you, I can't see, let thorough investigation be done to rule out blindness truly. Now, still on treatment, calm her down with hypnosis if she's restless, address family disharmony or the infidelity, because without that, she's coming back. Address the care of the kids with social worker, because without that, the kids will be in trouble. No one is looking after them. Nobody's going to feed them, clean them, take them to school or anything. So social workers will be helpful here. Address finances if that's part of the problem. Refer her to psychiatrist or neurologist. Okay, that will be appropriate. Don't think you want to end it right there by yourself. Refer to psychiatrist or neurologist. Do nothing or just observe only, depending on how intense the symptoms is or are. So you might just observe in some cases, but if the presenting symptom or symptoms is or are so intense, then you have to do something. Refer appropriately, no abort seizures if that is the case. Now, expected outcome. Sudden 100% recovery is possible. Is that surprising? Of course, no. You've done all investigations. You've done your physical examination. Everything is pointing to nothing, no disease, no physical illness. So, expect, observe, false, now recovery, right? And some will come down with full recovery, 100%. It may last for days or weeks. And in some, there will be gradual reduction in the intensity or the number of symptoms. Lastly, there's still unexpected outcome. Some will develop a long-term conversion disorder, which is not a good news. Others will have new conversion disorder if they've not sought medical attention, or they did, but the underlying psychiatric condition has not been addressed, including the psychosocial stressor, okay, like the infidelity in the partner. Now that has not stopped, then there's the likelihood of relapse. Tremors or seizures may persist, and 25% of them will have the condition to reoccur, and 25% will likely show new symptoms later on. The rest will have spontaneous recovery. But before closing this, remember, this woman has not faked these symptoms. These symptoms are real. The only thing is we must do everything to be sure this has no true underlying disease or physical illness or any psychiatric condition like personality disorder or dissociative disorder has been addressed. Then make appropriate referral to the psychiatrist or neurologist so that there will be no relapse and the keys are taken care of. Thanks for listening. Remember to share this presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it.